Welcome back to my channel, Why Do People Mask Suicidal Thoughts? If you're new to the channel and you're wondering why do I have these masks on, well, let's define mask. According to Webster, mask is to hide, to conceal, or to pretend. So I'm using these masks as an illustration or an example. What people do, we mask our true feelings when we are experiencing a mental health crisis, when we are having suicidal thoughts and struggling with depression and anxiety. We tend to mask and pretend like everything is okay while we're suffering. I would like to start off with my disclaimer. I am not a licensed psychiatrist, a licensed psychologist, or a licensed psychiatrist, or a mental health therapist. I am simply a woman who have lived through these traumatic experiences and currently living with a mental illness condition. So it is my goal is to empower you, to encourage you to learn to start taking off your mask and reaching out for help when you are struggling with your mental health, when you are having suicidal thoughts. I want to help save your life. God spared my life, and I'm here today because I want to inspire you and encourage you to speak out and know that you're not alone. According to the CDC.gov, the latest data in 2020, suicide was the second leading cause of death for kids ages 10 to 14 and 25 to 34. Yes, I said the second leading cause of death. And it was the ninth leading cause of death for ages 10 to 64, according to the latest data that was listed on the CDC.gov's website. And over 1.2 million people attempted to kill themselves in 2020, according to the CDC.gov. So I am a survivor myself, and I know how that feels to be in a dark place and feel like you've lost hope and you want to give up. But I encourage you, I thank God that He spared my life, because I want to encourage you that help is available. You can reach out to the licensed psychiatrist, the licensed therapist, and the licensed psychologist. They are trained professionals to help diagnose your condition and provide you with a treatment plan. It's no different from a physical ailment. If someone has something wrong with their heart, they go to a heart specialist and they begin to provide a treatment plan. So with your mental health condition and your mental crisis, it's the same way. You have a team of doctors that will evaluate you and assess you so they can begin to provide you with the treatment plan. So help is available, people. You're not crazy. It's called a mental illness. Last week, I asked you to go on a journey with me virtually in your mind, a road trip, and it was called Ground Zero, where I wanted to unpack what was mental health, what are the specialists to contact when you're having a mental crisis. So on last week, we discussed those options. And also depression. A lot of people try to mirror sadness and depression lumped up into one thing. However, you cannot. They are tied, but they are different. Sadness is an emotion. Once you go through something traumatic in your life, a loss of a loved one or loss of a job, yes, our mental health is challenged with that emotion of sadness. However, typically we rebound pretty quickly when we experience those events. However, someone that has depression, their reaction is totally different from sadness, because when they lose someone or have a traumatic life experience, it is persistent sadness that is a mood. Depression is a mood disorder. So it affects the way they think, it affects the way they function, and it is debilitating. And depression, people, major depression disorder is a mental illness. However, it is treatable. So I want to inspire you and educate you that, yes, if you are struggling with your mental health and you don't know what's going on, but you know you have erratic behavior, sadness, you can't get out of the bed, you have suicidal thoughts, you've become to be hopeless, hope is available because I just went over the 3 team of specialists for you to contact. Also, the suicide prevention hotline. They're available 24 hours a day, 7 days a week. They can be reached at 1-800-273-8255. Again, they are available to assist you when you are having a mental health crisis and when you have become suicidal and you want to end your life. Please contact the suicide prevention hotline. Help is available. Please call 911 because your life is an emergency. Please reach out to those positive friends and family. We want to coach you back to get you back stable. You can live with the mental illness. Is it difficult? Yes, but it is attainable. I am your witness. 12 years living with the mental illness, and I'm here today, suicidal free. Yes, I have debilitating days. I myself suffer from bipolar depression, where you have extreme highs, where you feel euphoric, like I can do anything. And then I have episodes of extreme lows where I'm depressed and have high anxiety. So yes, I understand that I live with this condition, but it is possible. I have the proper tools, the roadmap, my team of doctors, and I am living today, and so can you. If I can live, I'm no different from you. So with that said, also I had commended Lil Wayne, phenomenal rapper, Lil Wayne. He came out, interview last August, and he shared his own struggles with mental health. He was so transparent and vulnerable. He shared that at the age of 12, he attempted suicide. Thank God his plan didn't work, and he is here today. And we are so grateful that he will use his platform and his own testimony to encourage people to take mental health more seriously. So we commend him for using his platform, being vulnerable and transparent, so he can help save lives and let people know that himself had struggled with mental health, and it's okay to reach out. This week, I wanted to commend Mark Cuban. Mark Cuban has created a pharmaceutical company called Cost Plus Drug Company. Their mission, he says, organization spends thousands of dollars working with the outside firms to create their mission and value statements. However, ours grew organically from our CEO and lead backer, Mark Cuban. The markup on potentially life-saving drugs that people depend on is a problem that can't be ignored. It is imperative that we take action and help expand access to these medications for those who need them the most. That is Mark Cuban and Alex Cost Plus Drug Company initiative, what I just read. That is phenomenal. That is outstanding. It is commendable for them to create a company with the people in mind. They are choosing people over price, because in this industry, with the pharmaceutical industries, it's sad to announce that you all are choosing price over people. You're choosing price over patients. I myself has recently had a challenge with getting my medication. For a 30-day supply, my medication was $630 for a 30-day supply. That is outrageous. That is out of reach for me. Sickness does not happen just to the wealthy. It happens to the poor, the middle class. It happens to us all. and we should have access to affordable medications. Yes, and I want to be transparent and honest with you. I'm asking you to be transparent and unveil your mask and open up to friends and family. I myself, I want to be transparent with you. I had to open up to my friends and family and ask to help pay for my medication and go get a loan. So I don't know how I'm going to continue to pay these high prices as well. So that's the reason why I wanted to commend Mark, Cuban, and Alex for creating Cost Plus Drug Company, because they are trying to make this medication affordable for all. We shouldn't have to choose whether we're going to eat, sell my belongings, or move with friends and family to get our medications. The pharmaceutical industries, you guys make billions of dollars a year. I feel that it is unfair to make this medication unreachable, unaffordable. What am I supposed to tell my son when he looks at me and he wants something at the grocery store, and I have to say, no, we can't get this because we need to get my medication? I want to live. I've done the work. 12 years. I've been in and out of a mental institution. I had my brain shocked. I've been to therapy, inpatient, outpatient. I did the work and I want to live. Please make this medication affordable. We must choose people over price. Recently, I was on YouTube and I saw a documentary, and it was on DW Documentary. And it was posted, I believe, September the 12th in 2021. And the topic was Big Pharma, and that's short for pharmaceuticals. And it says, how much power does drug companies have? I was so devastated by looking at that video clip. I was saddened, disheartened. There was a previous hedge fund investor, and he bought the rights of a drug called Daraprim. Daraprim originally was $13.50, which is an affordable cost for medications. However, when he bought the rights to that medication, he increased that medication from $13.50 to $750. People, that was a 5,000% increase. That is outrageous. That is outrageous. The pharmaceutical industries, we need to challenge you. I am your consumer. I've been a consumer of your product for 12 years. First, yes, I'm the first one to commend you. Thank you for your company. Thank you for creating scientists that are creating life-saving medication. However, will it be life-saving if we can't get it? If we can't afford it, it won't be life-saving. So what is the purpose of you creating the drug? It is to hurt us or to help us. We must choose people over price. That is the reason why I commend Mark and Alex, because they said we will provide low-cost, high-quality pharmaceuticals to the consumer by any means possible. Yes, and they said, Mark said, I could make a fortune on this, but I want. He said, I get enough money. I rather challenge the drug industries in every way possible. And that's what we must do, people, because I know I'm not the only one that's impacted. How many lives have we lost because the medication is out of reach? Do you want the medication to sit on the counter to collect dust? People need this medication to live. I want to live. Help me live. I don't want to look at my little boy and say we have to move out to friends and family or a shelter just to get my medication. You guys are making billions of dollars. I've never seen a casket buried with billions of dollars, but I see people buried. How many people have been buried and lives that we have lost because the medication is out of reach? It's unaffordable. We must choose people over price. This is unfair, un-American. Because I know I'm not the only one that is experiencing this. What about the seniors that are at home? I'm almost a senior, and they have to choose between medicine or eating. This is unfair. We must stop the bleeding. We must stop the bloodshed. How much blood do you have on your hands? Because people could not get access to affordable medication. And I apologize for my voice being a little elevated. I'm just very upset listening to that interview that they will take a medicine that was affordable, $13.50, and increase it by 500%. That is outrageous and ridiculous, because you, pharmaceutical industry, have chosen price over people. And to be quite honest and transparent, it is simply greed. So I commend Mark Cuban and Alex on their company. Hopefully one day my medication can be a part of provided on their website. Currently it is not, but they are doing their due diligence and putting drugs on their company all the time. So their initiative, again, is to dismantle the drug industry and to challenge them to lower this medication. I commend them because go on their website, Cost Plus Drug, and see if your drug is there, because they are making this medication affordable for all. So if you would comment on this, if you are struggling to get your medication, or do a video, because we must request a seat at the table with our government to demand answers, to demand why is the pharmaceutical companies allowed to make this much percentage increase. I want to say these numbers again so you can get them in your mind. $13.50. And then it went up to $750. A 5,000% increase is simply outrageous. So people, thank you for listening to my channel. I apologize for being a little elevated with my emotions today because, again, I'm impacted. I don't know what I'm going to do to get my medicine from month to month, because I have to pay $630 while the pharmaceutical company sits back and collect billions of dollars a year. Money that you will never spend is outrageous to me. So again, people, I would like to thank you for your time. I always would like to leave you and encourage you that your now is not your forever. I know your story because I myself lived it and am living it. So I hope this is inspire you and encourage you to stop suffering in silence, to reach out when you are struggling with your mental health. I want you here, and I know you want to be here. You just don't know how. So we're going to go on this journey together and learn how to reach out, and we're going to learn how to live. Thank you, and have a great day.